Mr. Speaker, we're in the midst of one of the toughest periods of this pandemic. Yesterday saw 1,820 deaths, which is the highest toll since the crisis began. And as we endure these dark days and the restrictions we must all follow to save lives, we know that we have a way out, which is our vaccination program. And thanks to the hard work of so many people, we now have an immense infrastructure in place that day by day is protecting the most vulnerable and giving hope to us all. I'm glad to report to the House we now have given over 5 million doses of vaccine across the UK to 4.6 million people, making good progress towards our goal of offering everyone in priority groups 1 to 4 their first dose by the 15th of February. This is a huge feat and one in which we can all take pride. We're vaccinating at a greater daily rate than anywhere in Europe, twice the rate of France or Spain or Germany. But Mr. Speaker, this first 5 million doses is only the beginning. We're opening more sites all the time in cathedrals and food courts, in stadiums and conference centres, GP surgeries, and many, many more. Today, a cinema in Aylesbury, a mosque in Birmingham, and a cricket club in Manchester have all come on board as part of 65 pharmacy-led sites across England that are joining our vaccination programme this week. This ongoing expansion will help us to protect even more of the most vulnerable even more quickly. Also, from today, we will publish more localised granular data broken down by NHS STP area as well as by region, so the public have the best possible information about all of this work. Mr. Speaker, this virus is a lethal threat to us all. And as we respond through this huge endeavour, let's all take comfort in the fact that we're giving 200 vaccinations every minute. But in the meantime, everyone must follow the rules to protect the NHS and save lives. And we can do that safe in the knowledge that the tide will turn and that with science, we will prevail.
I call you, Merriman, who has 2 minutes.
Speaker, thank you very much for granting this urgent question. And can I also thank the Secretary of State both for his update and all the time and devotion he gives to this matter, and also the Vaccines Minister as well, who's doing an amazing job. Everyone, Mr. Speaker, is doing an amazing job across the country to roll out this vaccine, and I absolutely salute them all. That includes my Westminster office manager, Iona Cullen-Stevenson, who's been vaccinating herself. Mr. Speaker, in my part of rural East Sussex, the vaccine has been slow to reach rural Rother, Battle and Heathfield residents. In 200 square miles that I represent, only one surgery has been vaccinating. Now, that's got better from this week, and I welcome it and welcome the team, the Sussex Community NHS Foundation team. Adam Doyle and his team have been amazing to us as MPs. 3 questions for the Secretary of State for the rural areas. Firstly, can we draw up a new vaccine contract for GPs, which guarantees they'll only receive AstraZeneca and not Pfizer, which of course they find difficult to store? Many GPs in my area tell me that they will sign the contracts if they can get AstraZeneca only. So that would be just like the pharmacy contracts. Secondly, we'll soon have the welcome challenge of delivering the vaccine to cohorts, priority groups 5 to 9, but we'll also have to, at the same time, deliver the second dose to the priority 1 to 4 cohort, who of course are more vulnerable. Can we ensure that those latter priority groups perhaps go to the hubs because they find it easier to travel, and that we use our local GP surgeries to redose those priority groups 1 to 4? And thirdly, I know that the government relies on the manufacturers for supplies, but can we try and give a more forward-looking supply level to our county teams so that they have indicative estimates so that they can plan better on the ground? Mr. Speaker, finally, can I just say I welcome the statement from the government. I would ask that there is an opportunity every week for colleagues to be able to question members of the government. We, of course, receive those updates from our own community teams. It's surely right that we can put those same questions and ideas to the front bench. Thank you.
Before I bring the Secretary, just to say it is your UQ rather than the government coming forward with a statement. We've had to ask for it. Here we have Secretary of State.
Thank you very much, Mr. Speaker. Just on that last point, we typically do come forward with a statement at least once a week. And I'm very happy, of course, to answer questions at any time. As you can see, I'm self-isolating.
Order. Can I just correct the Secretary of State? We've not had one for over a week. Secretary of State?
Thank you. But typically, I've come forward at least once a week, and I'm very happy to do that and respond to questions at any time. I'm very glad that technology is working, and I'm able to do that from self-isolating at home as I am now. On the substance of the questions from my honourable friend, the first thing I'd say is I'm absolutely delighted that there are new centres opening in Sussex, in Ticehurst Village Hall this week, so that the rollout can reach all parts. I'll consider the point that he makes about cohorts 5 to 9, which will need the vaccination for the first dose at the same point as we start the second dose for those who've been vaccinated from the start of January, making sure that we have those second doses available as close as possible to the largely elderly population who will need to get the second doses when we restart with the second doses. That is an important issue, and I'll take away the point that he raises. The challenge on the contract is that it's tied in with the first and third of his questions. The challenge to supply is essentially that we have a lumpy supply. The manufacturers are working incredibly hard to deliver the supply as fast as possible, and I pay tribute to them and their work. But it is challenging, and therefore it isn't possible to give certainty as far out as many GPs and of those delivering on the ground would like, because the worst thing will be to give false certainty. So we do try to give information about what's coming next week, but going further out than that until the supply smooths out, which it will, I'm sure, over time. I think that would give false certainty, and the worst thing would be to have GPs across the country booking in large numbers of people and then having to reschedule those appointments unnecessarily. And so I'll take into the account the point that, of course, the Oxford AstraZeneca vaccine is easier to deliver in rural areas, and the request that some people may be able to do that, but at the moment we have to use the contract that we've got.
Call Shadow Secretary of State Jonathan Ashworth with 2 minutes.
Mr. Speaker, yesterday I visited the vaccination centre at Leicester Racecourse, Mr. Speaker, and it was inspirational to see the joy on the faces of those vaccinated and the pride of the staff and the volunteers doing the vaccination. 4.6 million is indeed welcome, and it is a reminder that when the NHS is put in charge and tasked with implementing a large-scale project across our communities, they get on with it and they deliver. Mr. Speaker, the Secretary of State has a target to vaccinate care home residents by the end of the week. Could he update us on progress towards that target? Today, we've had the latest Imperial survey, and the findings are alarming, especially concerning that infection rates are so high in London, yet London and East of England appear to be behind the rest of the country on vaccine rollout. Can he tell us what action is being taken to speed up vaccination across London and the East of England? The Imperial survey also highlights the disproportionate infection rates amongst key workers and those from Black, Asian, minority ethnic backgrounds. So once the 9 priority groups are vaccinated, is it his expectation that we will then move to prioritise key workers, teachers, police officers, firefighters, transport workers, supermarket staff, who are more exposed to the vaccine, to the virus at the moment? He will know there are 11,000 community pharmacists. That could mean up to 30,000 pharmacists at the heart of delivering this vaccine. We should be using them, not just because of the volumes of doses they can administer, but because they have years of experience of building trust and vaccine acceptability within hard-to-reach groups and minority ethnic communities. I was speaking to pharmacists this week in Dudley who were telling me this. They also, by the way, raised concerns about the wider supply of the consumables needed to administer the vaccine. Can he guarantee that there will be no delay or shortages in the delivery of this wider kit? Mr. Speaker, the new variants remind us we have to go further and faster on vaccination and work harder to break admission chains. Early analysis suggests the South African B1351 variant brings a reinfection risk, which means vaccines may need to be redesigned. Has he got a contingency plan in place? Finally, Mr. Speaker, yesterday's death numbers were truly horrific. Vaccination has to go hand in hand with measures to suppress this virus. That means further containment measures. Not everybody can work at home comfortably, Mr. Speaker, or isolate themselves. The system is still expecting families to go hungry to stop spreading infection. Can I urge him again to fix sick pay and give people proper financial support so they can isolate and we can drive infection rates down?
Secretary of State.
Well, thank you very much, Mr. Speaker. And I agree with the honourable gentleman that the NHS is doing a great job and supported by so many people. In particular, I want to thank the volunteers who've stepped forward, tens of thousands of them, and are now working to deliver the vaccination programme alongside NHS staff and, of course, members of our armed forces. And in fact, there are several members of this House, Mr. Speaker, who are, as we speak, supporting vaccination in vaccination centres, and some of them are vaccinating themselves. So I'm very grateful to all the volunteers. He raises the question of pharmacies. Absolutely, pharmacies are going to be incredibly important, especially for reaching into those communities who may be otherwise harder to reach. The NHS as a whole is highly, highly respected and trusted in all communities of this country, and so is well placed to do that. And pharmacy colleagues within the NHS are particularly so because they are often the closest to their communities. As I set out, we've opened 65 vaccination centres that are pharmacy-led this week, with more to come. And he asked about the residents of elderly care homes. I'm delighted to say that 63% of residents in elderly care homes have now received vaccination. That is a really significant increase over the last week. And we're on track to deliver on our goal of vaccinating elderly care home residents by the end of this month. And I hope sooner than that. Finally, he asked about the question about the potential need for vaccine redesign if there is a new variant that is not effectively dealt with by these vaccines. Obviously, we are vigilant to this and keep this under close review. I'm glad to say that the early indications are that the new variant is dealt with by the vaccine just as much as the old variant. But of course, we're vigilant to the new variants that we're seeing overseas. He mentioned the South Africa variant. There's also a variant of concern that was first identified in Brazil. And of course, we're vigilant on these matters too. What I'd say is, in summary, though, is that all of these things just support the need for everybody to follow the rules and stay at home. It is critical that everybody does their bit to try to stop the spread of this virus whilst we get the numbers under control, we bring them down, thus protecting the NHS and getting this death toll down because it's far too high.
Centre Surrey with the chair of the Select Committee, Jeremy Hunt. Jeremy Hunt.
Thank you, Mr. Speaker. This week, the ONS said prevalence rates nearly doubled during the November lockdown, and today's REACT study says infections are still rising. Isn't the reality that these new strains are massively more dangerous and hard to control than many realise? So if we're going to bring down the horrific death rates that we're now seeing, should we not be securing our borders with quarantine hotels, ending household mixing outside bubbles, and following Germany in mandating FFP2 masks in shops and on public transport to give better protection to wearers?
Secretary of State.
Thank you, Mr. Speaker. We have looked at the question of PPE with respect to the new variant, and the clinical advice I've received is that the current guidelines are right and appropriate. On international travel, as my right honourable friend knows, we brought in very significant measures last week to close the travel corridors, and we remain vigilant to what we need to do to guard against new variants coming in from abroad. The new variants do change this question because it's not just about ensuring that we don't get extra cases coming in from abroad, in which case, if an area, if a country has lower case rate than us, then there's no more risk than people staying here in this country. It's about the new making sure that new variants that might not be dealt with as effectively by the vaccine, and making sure that those new variants don't arrive and stopping them from coming. So that is something on which we've recently taken very significant action. And of course, we keep under very close review.
We now head to the SNP spokesperson, Martin Day, who's participating virtually, who's got 1 minute. Martin Day.
Thank you, Mr. Speaker. With supplies of the Pfizer vaccine expected to be temporarily lower for a few months, and with delivery of the Oxford AstraZeneca supplies behind target, there is both public and professional concerns. So what level of supplies can the Secretary of State guarantee over the coming weeks and months so that health services can plan appropriately? Given the UK has procured vaccines on behalf of the 4 nations, how much of this reduced supply will come to Scotland? And was knowledge of vaccine supply disruption behind the UK government insistence on removal of supply numbers from the Scottish Government vaccine delivery plan?
Secretary of State.
Thanks very much, Mr. Speaker. Well, as I've said many times, the supply of vaccine is the rate limiting factor for the rollout, and we share that supply fairly and equally across the UK. There is a lumpy supply schedule, and making this stuff isn't easy. It's not just a chemical compound, and I've described that many times. Ultimately, this is a UK programme delivered in the devolved nations by the NHS, being done brilliantly across by the NHS. And I just say that the effort is one of massive team working to try to get this out as much as possible, as fast as possible, and to work, that's teamwork both across the 4 nations of the UK, but also teamwork with the suppliers to make sure we get as much supply as we can, as quickly as we can.
Sent to the Father House in Worthing with Sir Peter Bottomley. Sir Peter.
Can I add to the good questions by our honourable friend, Member for Bexhill and Battle? The questions raised in effect by Sheila Fogarty in today's Daily Telegraph of LBC about confusion over the housebound as well as the homebound. We know that people are going to be vaccinated in mass centres. I had a chance to see one yesterday, in local hubs and at home. And too often people are sitting at home wondering which they're likely to be. So could the Secretary of State please get the Partnerships for Integrated Care, the STPs, to make public how soon they expect to get to most of the people who are over 80, especially in the semi-rural constituencies?
Secretary of State.
Well, I can answer the question for my honourable friend, which is that we will offer vaccination to everybody in the top 4 categories: the over 70s, the clinically extremely vulnerable, and health and social care workers, including the residents in older people's care homes, by the 15th of February. And so I'm sure that he, like me, and like many of us in this house, get asked by constituents all the time, when will the call come for me? And the answer is that we are working through that list, and that we will reach all of those groups with an offer to be vaccinated on or before the 15th of February. Now, you know, the exact order within that queue is for a local area to decide. And sometimes people might get invited to 2 different methods of vaccination, whether to one of the big sites and by their local GP. And for people who are housebound, then there are roving teams led by the local primary care networks to get out and vaccinate them. So the offer will come, and people should be assured that whilst as of today, around 2/3 of all over 80s have been vaccinated, which is very, very good progress. That means that there's a third still to go, and we will get to everyone, and we'll make sure everyone gets that offer to be vaccinated by the 15th of Feb.
to Twickenham with Munira Wilson. Munira Wilson.
Thank you very much, Mr. Speaker. Given the concerning data coming out of Israel regarding the efficacy of the first Pfizer dose, which may be quite a lot lower than was first expected, is the government planning to review its policy of delaying the second Pfizer dose by 12 weeks? And very specifically, will the Secretary of State consider giving healthcare workers who are being exposed to the highest viral loads, will he consider giving them an early second dose so they get maximum protection? It's as important as PPE.
State.
Well, I'm glad to say, Mr. Speaker, that I can reassure the Honourable Lady that having looked into the data that underpinned the article in The Guardian that I think she's referring to, the data actually support the data that we have been basing our decision on to move to a 12-week dosing schedule, so 12 weeks from the first to the second dose. And the government chief scientific advisor was asked about this in the media yesterday, and explained clearly why we were able to make that decision, because around 89% efficacy comes from between days 14 and days 21 after the first dose, and so of course we keep we're looking at this data, and in fact we're measuring the efficacy here at home from those who've been vaccinated by matching the data between those who've been vaccinated and those who test positive, and we're monitoring that, and we will publish that data as soon as it is clinically valid. And so it's a very important question, but I'm glad to be able to reassure her that the headlines that she read in The Guardian are not quite right.
Lincolnshire with Leah Nietzsche. Leah Nietzsche.
Thank you, Mr. Speaker. The NHS teams across North East Lincolnshire are working hard caring for patients with COVID, and now they are doing a fantastic job administering the much welcomed vaccines. Will the Secretary of State join me in congratulating them? And can I ask him if he has plans to introduce a personal vaccination record for travel and other purposes?
Secretary of State.
Thank you very much, Mr. Speaker. Well, I'm delighted that in the Humber, Coast and Vale NHS area, 142,000 people have now been vaccinated, and I'm very grateful to my honourable friend and NHS colleagues and colleagues across the House for that huge effort. I congratulate the local NHS in North East Lincolnshire for the work that they're doing in getting these vaccines out. And in fact, I was able to talk to some North Lincolnshire colleagues in the NHS who are doing a fantastic job, because they'd managed to get to all of their care homes, which is absolutely terrific. So Lincolnshire's doing a great job with the vaccine rollout. On the specific question she asked about travel and the link to vaccination, I think it's too early to have a firm view, because we've got to see the impact of vaccination on the transmission of the disease. But obviously, when somebody is vaccinated, that event goes into your health record, which is held by the NHS, and so it is recorded so that you can demonstrate that you've been vaccinated if needs be. But for the time being, we're being very cautious on travel because of the risk of the new variants, especially if there's new variants where the efficacy of the vaccine is lower.
Northern Ireland with Jim Shannon. Jim Shannon.
Thank you, Mr. Speaker. And can I also thank the Secretary of State for his health statement and for his regular updates. Would the Secretary of State outline the discussions that he has held with the Ministry of Defence to ensure that hospitals throughout the United Kingdom of Great Britain and Northern Ireland can avail of the highly skilled workforce and logistical expertise of the armed forces? And for those who seem perplexed, outline the rationale for making use of this tremendous weapon in the arsenal in the fight against COVID, within the United Kingdom of Great Britain and Northern Ireland and saving lives. And will the Secretary of State join with me in thanking the Northern Ireland Executive in taking this step to save lives, regardless of any perceived political point that others may very shamefully make? Thank you.
Secretary of State.
Well, thank you very much, Mr. Speaker. The armed forces have been incredible in their support for the efforts that we've all nationally had to go to tackle COVID. And that's also true with the vaccination programme, especially the logistical expertise that the honourable gentleman refers to. And this UK-wide vaccination effort has been supported enormously by the armed forces. I'm very, very grateful for the work that they've done, really going the extra mile to help save lives.
Mr. Robsey with Caroline Noakes. Caroline Noakes.
Thank you, Mr. Speaker. I'm very worried about domiciliary carers who might be privately employed or via an agency and how they're going to access the vaccine. It's very probable that their employment status is not known, yet they could be going into several homes per day helping vulnerable people. Can my right honourable friend reassure me that these brilliant carers are not going to be forgotten?
Yes, absolutely. It's incredibly important. And we're working to ensure as many as possible are identified. Also, category 6 within the JCVI categorization specifically specifically identifies those carers who may not be paid carers in a care home, but nevertheless care for vulnerable people as part of the early vaccination effort because of the incredibly important work that they do.
To Walthamstow with Stella Creasy. Stella Creasy.
Thank you, Mr. Speaker. I'm sure that every MP has had families in their local community who have been shielding for almost a year now because they have family members who are extremely clinically vulnerable and indeed are housebound. The Secretary of State said that everybody who was housebound should get a vaccination by the 15th of February, but as yet nobody seems to have seen any of this start. So can the Secretary of State confirm when the Oxford vaccine will be given to those roving teams that he mentioned, and how many people are housebound in this country and are being identified as such to ensure that they don't miss out on the vaccine?
Secretary of State.
Well, absolutely, that work is underway. And specifically in her constituency, I'm delighted that this week, Michael Franklin chemists are starting their vaccination. And they, along with the local primary care team, will be able to reach people who may not be able to travel. It's an incredibly important part of the vaccination rollout to make sure we take the vaccine to those who are housebound. And Michael Franklin chemists will be using the Oxford AstraZeneca vaccine, which of course is much more easy to transport.
Issue with Robert Logan. Robert Logan.
Thank you, Mr. Speaker. So far, there are 3 vaccination centres up and running in the High Peak. I pay tribute to all those who are working so hard to roll out the vaccine locally. However, currently the rate of the rollout is being limited not by the number of vaccination sites or trained vaccinators, but supply of doses coming from AstraZeneca and Pfizer. Can the Secretary of State outline to the House what steps he and his ministerial colleagues are taking to work with these pharmaceutical companies and help them ensure that the supply of the vaccine continues to flow to the High Peak as quickly as possible?
Well, he's absolutely right. My honourable friend is absolutely right that the rate limiting step is the amount of supply that we've got. We're working very closely with the 2 companies who are doing a terrific job. And we talk to them all the time in trying to ensure that any blockages are removed, and they are going as fast as they can in producing the vaccine, whether that's the Oxford vaccine produced here in this country or the Pfizer-BioNTech vaccine produced in Belgium and supplied in. And everybody's working as fast as we can. And I'm delighted that the NHS is chomping at the bit to have more supply in order to deliver it. However, I would say that across Derbyshire, there now have been over 70,000 vaccinations, 70,332 up to the latest data that I have as of the 17th of January. And also on the latest data, Derbyshire has vaccinated 65% of its over 80s, which is almost exactly on the national average of 67%. So Derbyshire is doing a great job. And I want to congratulate the NHS in Derbyshire, thank them for their efforts, their work. There's still a lot further to go, but almost 2/3 of Derbyshire's over 80s have been vaccinated, and we've got to keep at it and keep working hard to make sure that all the vulnerable are protected, and then move on to the rest of us.
Let's head up to Kingston upon Hull with Carl Turner. Carl Turner.
Thank you, Mr. Speaker. After questioning the Prime Minister last week, I'm delighted that the first community pharmacies are now taking part in the vaccine rollout. But just a few hundred of approximately 11,000 community pharmacies just doesn't seem enough. It's a tiny proportion, leaving vast potential untapped. So will the Secretary of State commit to ensuring that all general Pharmaceutical Council registered technicians will be allowed to administer vaccines so that they're available where they're most needed, on every high street, in every community, like mine in East Hull? Witham Pharmacy is ready and willing to start vaccinating now. Let's get on with it.
Thanks very much, Mr. Speaker. So at heart, I agree with the instincts of the honourable gentleman. The challenge is that we need to do this at scale, and since supply is the rate limiting factor, it's very important that anywhere that has that is a vaccination site can get enough people through to be able to use the vaccine in the time that it can be used. We don't want to leave stocks in the fridge. Now, pharmacists are absolutely experienced at vaccinating, and pharmacy technicians can vaccinate. And they're a very important part of the programme. But with pharmacies, we've started with the bigger sites able to get the higher throughput through. And because supply is the rate limiting factor, we need to make sure that all supply is used up very quickly from the point at which it's distributed. And so that's why we've taken the approach that we have. And I'm really, really thrilled that so many pharmacies are now coming on stream, and there's lots more to do.
Let's go to Lee Anderson in Ashfield. Lee Anderson.
Thank you, Mr. Speaker. I volunteered at one of the brilliant vaccination hubs in Ashfield, and there's one thing that we're not short of, and that's people turning up every single day to get the vaccine. But we need more capacity to win the war quicker and save more lives. So could my right honourable friend please tell me what he is doing to ensure that the people of Ashfield and Eastwood get their vaccination as soon as possible?
So say.
I'm absolutely delighted that my honourable friend is volunteering in a vaccination centre. I think it's terrific. This is a big national effort, and my honourable friend is playing his part. There's 49,000 vaccinations that had been done as of the 17th, so a couple of days ago, in Nottinghamshire. There's clearly, we've still got to do more, but we're making very significant progress. As I said before, the rate limiting factor is the amount of supply that we get into the country, and rather than, for instance, the enthusiasm of GPs in the NHS, or indeed the amount of volunteers who've stepped forward, like my honourable friend.
Let's head to Janet Davey in Lewisham. Janet Davey.
Thank you, Mr. Speaker. A constituent of mine, Mr. Clive Toombs, recently reached out to me regarding the crisis facing the London Ambulance Service. He told me no one he knows in the service have had a vaccine, despite them being on the very front line of exposure to the virus. At the same time, we've seen pictures of ambulances lined up for hours waiting to get into A&E departments. Clive suggested that with some coordination from your department, arrangements could be made for ambulance staff to receive vaccines from hospitals they are waiting in a queue for, if there is a surplus, and to prevent wastage. Could the Secretary of State tell me whether he has considered this possibility yet? Does he agree with me this is a humble approach from Clive, when in fact frontline ambulance staff should be prioritised for the vaccine?
Hey.
Frontline ambulance staff absolutely are and should be prioritised for the vaccine. They're in category 2, and we've got to make sure that that happens. So I'll take away Clive's idea, I'll work on it, and I'll get back to the Honourable Lady and see what progress we can make.
Let's head to Henley with John Howell. John Howell.
Thank you, Mr. Speaker. I welcome the opening of vaccination centres right across the country, including imminently at the Kassam Stadium in Oxford. But at a meeting that I attended last night of community leaders in Oxfordshire, no one had an idea of when the vaccine centre at Harwell was going to become operational. I wonder if the Secretary of State could oblige.
The date when it will open, there's a huge amount of investment going into Harwell to make sure that we've got cutting-edge vaccination manufacturing facilities for the future. It is a project that's being led by my right honourable friend, the Business Secretary. So I will write to my my honourable friend with all the details.
Let's head to Yorkshire with Rachel Maskell. Rachel Maskell.
Thank you, Mr. Speaker. I have serious concern that after people have had their first vaccine and indeed their second vaccine, that they'll have a false sense of security about the levels of immunity when we know that clearly even the efficacy after 2 vaccines is not 100%. Will the Secretary of State ensure that there are clear communications that people still need to follow the public health guidance of hand space and space of at least 2 metres even after 2 vaccines until it is safe to do otherwise?
Secretary of State.
Yes, Mr. Speaker, the Honourable Lady raises an incredibly important point, which is that after you've been vaccinated, you can still catch coronavirus for several weeks, and it's really important that people know this. When people are vaccinated, they are told essentially the time that it takes and the limit of the effectiveness, especially in that early period, and told very clearly that you have to still follow the rules. And that's an important part of this, especially until we can measure the effectiveness of the vaccination programme on transmission. In fact, only yesterday I reviewed the communications that go to people when they've been vaccinated, and they are very clear and robust, but it's important that everybody post-vaccination continues to follow those rules, both to bring the number of cases down because of the impact on transmission, and also to protect themselves. The vaccine is the way out, but it doesn't work immediately, and people still need to be cautious.
From policemen to teachers and shop workers to bus drivers, our key workers have been on the front line in this pandemic, and we owe them so much. Once the most vulnerable in society have been vaccinated, will my right honourable friend look to prioritise those who put themselves in harm's way to help others?
Secretary of State.
Well, my honourable friend makes a characteristically astute point. The priority, of course, has to be those who are clinically most vulnerable, and after that, we will make a decision based on I've called for a national debate on this. Who should go next? We'll look at the data on transmission and who transmits most, and we'll also, of course, consider key workers who often are in the front line themselves, whether that's the teachers or bus drivers that he mentioned, or others. So that is something that we're currently actively considering, and I'll take on board his suggestion.
Let's head up to Luton with Sarah Owen. Sarah Owen.
Thank you, Mr. Speaker. The success of any vaccine rollout relies on reaching every person who needs it. Research presented to SAGE worryingly found just 28% of Black, Asian, minority ethnic people intended to be vaccinated, compared with 85% of white British people. That is a huge disparity. I asked this question on January the 11th, but only got a holding answer. So I'll ask again. What is the Secretary of State doing to work with the most vaccine hesitant and vulnerable groups?
Secretary of State.
It's an incredibly important question, Mr. Speaker. We're doing a huge amount of work on it that's being led by my honourable friend, the vaccines rollout minister, who I think is on the front bench. The need to reach all communities is paramount, and that is ongoing now.
To Epsom with Chris Grayling. Chris Grayling.
Thank you, Mr. Speaker. One of the sadnesses of the past year has been the way in which families have been unable to see relatives in care homes, often in the last few months of their lives. I really commend the Secretary of State for his focus on vaccinating care home residents. All those families want visits to start again. What message can he give them about how quickly he can unlock care home visits again for those families? And can he also assure care homes that the government still regards the lateral flow tests that many want to use to vet potential visitors as being a viable, reliable, and able to be depended upon in allowing visits?
Secretary of State.
Yes, on that last point, that's a very important point, and we've published extensive analysis that supports that view. On the broader point, we are going to look at the effectiveness in the real world of the vaccine as it's being rolled out, and make sure that we look at who's been vaccinated and who is then testing positive in the future, to see the real world effectiveness of the vaccine rollout. And it's once we can see that effectiveness in the real world that we can then be able to consider all of the different restrictions that are in place. And visiting care homes is obviously one of the restrictions that we had to bring in, but I entirely understand its consequences and the impact that it has on the lives of some of the most vulnerable people in society.
Let's head up to Scotland with Alison Thewlis. Alison Thewlis.
Thank you very much, Mr. Speaker. The UK has acquired the rights to vaccinate more than the entire population multiple times over, as have many other developed nations. So can the Secretary of State tell us what steps the UK government is taking to make sure that those surplus doses of the vaccine are shared with less developed countries around the world, and will it encourage other countries to do likewise?
Thank you. We put more money into the international effort to ensure everybody around the world can be vaccinated than any other country. And that's not just more as a proportion of our GDP, that's more cash that's gone into these international efforts across the UK. And we can do that because of the strength of our international commitment as a country. So I'm very pleased that we've been able to do that. Obviously, turning that money into vaccinations is important. And there's a huge amount of work being done by COVAX to make that happen. So the UK can be proud of the work that we've done to support access for the most vulnerable, both of course in terms of the cash we put in, and because it is UK research backed by the UK government that has led to the Oxford vaccine, which is one of the two most appropriate for use in the developing world.
Richard Holden.
Thank you very much, Mr. Speaker. There's been some great vaccine stuff happening in North West Durham, but 98% of the care homes done and the housebound have been started from last week. And I'd like to thank the people working in the Crook and Tanfield View vaccine centres locally. I've heard that the pharmacy down in Bishop Auckland, which is helping some of my constituents, has just got the vaccine. But could the Secretary of State let us know? I've got a big rural area, some people 10 miles, more than 10 miles from a vaccine centre, when those smaller little hubs are going to be started, and also those smaller community pharmacies in my constituency as well are going to get that vaccine to help ensure that everybody across the country gets it as quickly as possible.
Secretary of State.
Yes, he's quite right to firstly to praise the teams across the northeast who've been doing an unbelievable job, and 98% of care residents in his area being vaccinated is something we should all celebrate. Making sure that everybody's within 10 miles of a vaccination centre is important. In the very rural areas, that may include being 10 miles from a mobile site, because we'll send in mobile sites to the most rural areas. But crucially, by the 15th of February, everybody will have the offer of a vaccine. Sometimes that they may get two offers, and one might be to travel, for instance, to go to Newcastle, where there is a vaccination centre. But if they get that invitation, they can still wait to have the more local offer of a jab from their primary care network. So it's there are different ways to make it happen, but he's absolutely right on the importance of getting this vaccine available for all.
Let's head down to Brighton with Lloyd Russell Moyle. Lloyd Russell Moyle.
Thank you, Mr. Speaker. Without increasing the 2 million doses a week to 5 million, we're going to be administering this vaccine to the adult population until the end of the year. And that causes great anxiety. People are confused and unclear if and when they will get a dose, particularly with informal carers who worry that they're not on anyone's list. Would the Minister or Secretary of State consider requiring doctors and the NHS to text or write to all patients, outline where they are on the list, so that people have a better, reasonable expectation about when they will be vaccinated, ensure their prioritisation is correct, and actually stop them phoning up the surgeries, blocking up the phone lines, asking them questions about when they're going to get their vaccine?
So, State.
Thank you very much, Mr. Speaker. Well, all those who are over 70 or who are clinically extremely vulnerable will have that offer before the 15th of Feb. And what that means in practice is that if you receive a letter when there are measures put in place recommending that you shield, and that letter either comes from me or from me and my colleague, the community secretary. If you receive that letter, then you are on the list to be vaccinated before the 15th of February. And after that, we will continue through the JCVI cohorts, which of course includes in cohort 6 those who are vulnerable but not in the clinically extremely vulnerable group. So we will get there, and we will invite people according to their clinical need. So my recommendation to the honourable gentleman's constituents is that they should wait for the NHS to get in contact with them. We have a programme to make sure everybody gets reached.
Let's head up to Cheshire with Edward Timpson. Edward Timpson.
Thank you very much, Mr. Speaker. And can I join my right honourable friend in praising the vaccinators, pharmacists, armed forces, NHS staff, support staff and volunteers right across the country, including in my Eddisbury constituency, for the considerable contribution they have already made to the national vaccine rollout effort. And in order to continue its acceleration, what action is my right honourable friend taking to ensure that all elderly residents in the first priority groups are aware that if they haven't already, they can get their jab administered locally in the next few weeks through contact from their own GP practice?
Secretary of State.
We've been in contact with all those who have been invited to come forward so far, and for those who haven't been yet invited to come forward, who are in the top 4 groups, we will be in contact before the 15th of February. And can I just add, Mr. Speaker, that my right honourable friend himself has been volunteering in his local vaccination centre and doing his part on the front line, and I think we should all thank him for that.
Let's head to Bristol with Kerry McCarthy. Kerry McCarthy.
Thank you, Mr. Speaker. I'm very pleased that my mother and I think her sister, my aunt and my uncle are having their vaccinations today. So it seems that the rollout to the over 70s is going well in Bedfordshire at least. But can I ask about young carers? Because we know that the 10 to 19-year-old group is particularly at risk of transmitting COVID, if not at risk from suffering badly from it. And many of them will be looking after people who are in the clinically vulnerable group. But at the moment, it seems that they won't be prioritised for vaccination, just the people who have more professional caring responsibilities. So can I ask the Secretary of State if he will add young carers to his list of people that, for the sake of the people they care for, will be vaccinated early?
So, State.
Thanks, Mr. Speaker. I'll absolutely look at that, and I join her in praising the rollout in Bedfordshire, which is going well. And it's wonderful to hear that so many people having personal stories of vulnerable members of their family who are being vaccinated. You know, this vaccination program is touching us all, and we've just got to get it done as quickly as possible to make people as safe as possible, as fast as we possibly can.
25 withdrawn, so we go to Wales with Geraint Davies. Geraint Davies.
Mr. Speaker, coronavirus deaths are 10% higher in areas of only slightly higher air pollution. So will the Secretary of State bear this in mind in his priorities for rolling out the vaccine? And more importantly, will he ensure that in next week's Environment Bill, the World Health Organization air quality limits are introduced so they have immediate effect and are legally binding to save thousands of lives from coronavirus next year and tens of thousands of premature deaths from air pollution next year, given that as many people die from pollution every year as died from coronavirus last year.
Thank you, Mr. Speaker. The honourable gentleman is an irrepressible campaigner in tackling air pollution. There is a link from air pollution to your risk of dying from COVID, and this is something I've been talking to my right honourable friend, the Environment Secretary, about.
Right, let's head to Gordon Henderson in Sittingbourne and Sheppey. Gordon Henderson.
Thank you, Mr. Speaker. A large number of people over the age of 80 have not yet received their COVID vaccinations in Sittingbourne and Sheppey, and that's not because of lack of will, but because of a lack of vaccine. As an example, on the Isle of Sheppey, which has a population of 40,000, local GPs need to vaccinate over 1,000 people each week in order to reach the government's target of having every person in the first 4 priority groups vaccinated by February. Now, last week, the Sheppey Primary Care Network was promised 400 doses, but eventually received only 300. This week, they have been promised 1,200 doses, but local GPs worry this quantity will be cut also. I appreciate my right honourable friend is constrained by the number of doses delivered by the suppliers, but what can he do to ensure that both my PCNs in Sittingbourne and Sheppey receive the quantity they need to meet the government's target?
Secretary of State.
Well, my honourable friend asks an astute question, which in a way demonstrates the challenge that we have, because there's a call for, a demand for more early information about when vaccine will arrive. But because of the lumpy supply, if we give too much prior notice, then sometimes we do have to make adjustments like the one that he described. The good news is that we are on track to deliver the quadrupling of the amount of vaccine to the Isle of Sheppey, as he describes. Now, I, like him, very much hope that the full 1,200 doses will come, and we are sending more doses to the areas which have made least progress so far to make sure that we get that offer by the 15th of February to everybody equally, irrespective of where they live, across England for the English NHS, and indeed working with the DAs to make sure that that offer is delivered right across the UK fairly. So there is this prioritisation of the areas that have made least progress so far, and I'm working with NHS colleagues to make sure that's done as fairly and effectively as possible.
To Northern Ireland with Carla Lockhart. Carla Lockhart.
Thank you, Mr. Speaker. Firstly, can I thank the Health Secretary for the support being given to the people of Northern Ireland, and I know that he will join with me in thanking our frontline healthcare workers delivering the vaccine within our communities. The Secretary of State will know that the key to maximising the uptake of a vaccine is the assurance of its efficacy, but also that by taking part, it will enable life to return to normal, for schools to reopen, businesses to reopen, for family life, particularly with elderly relatives, either at home or in care homes, to be restored. The public need that hope, yet while we hear much positivity, we also hear of long-term restrictions of many aspects of what was and should again be normal life. Can the Health Secretary give an assurance that he will provide that leadership in terms of the public messaging and tone, and that he will provide a route map to the return of the liberty and those freedoms that we once enjoyed and want to enjoy again?
Secretary of State.
Absolutely, Mr. Speaker. We all want to enjoy those liberties again, and we want to do so safely. And the balance between those two is at the core of the conundrums of policy, and has been throughout this pandemic. The critical thing is to make sure that we get this vaccine rollout as fast as possible, and that is at the centre of the route out throughout these islands and indeed across the world. So I understand the yearning for a clearer map out. Until we know the impact of the vaccine on transmission, it is harder to put to put timescales on that. We have to watch the data. We have to watch the data because I want to see the number of cases come down, of course, but the reason that that matters so much is to see the number of hospitalizations come down and to see that fewer people die each day from this dreadful disease. And, you know, the numbers that were published yesterday of the people who died at 1,800 is truly terrible, and we need to make sure that we protect life.
Let's head to Southend with Sir David Amos. Sir David.
Will my right honourable friend join me in congratulating Anthony McKeever and his team on ensuring that people in Southend are vaccinated? However, would he reassure me that Southend will receive its fair share of vaccines, that the four most vulnerable groups will all be vaccinated by the middle of February, and finally, that people in their 80s and 90s are not asked to travel long distances to a hub in Wickford?
So, State.
Yes, that's our goal. All of those things are what we're aiming for. I'm really, really grateful for my honourable friend's support. 80,000 people have now been vaccinated in Mid and South Essex, in his area. We've made a whole load of progress, but there's much more to do to make sure that the vaccine is there and fairly there for everyone.
Let's head to Oxford with Layla Moran. Layla Moran.
Thank you, Mr. Speaker. The flooding over the last few days has already displaced thousands from their homes and threatens many more over the coming days. And for those who are elderly or vulnerable, wondering how they're going to receive the coronavirus vaccine is just an added worry they don't need, especially if they have to move into other regions to stay with family or indeed into temporary accommodation, which he will know can sometimes be for months. Can the Secretary of State tell us whether the government has a plan for vaccinating people displaced due to flooding at this time?
Sir State.
Yes, of course. Flooding brings additional challenges, but we will overcome these challenges too.
To Devon with Selene Saxby. Selene Saxby.
Thank you, Mr. Speaker. The vaccination rollout programme is a huge national success. Well done, and thank you to everyone involved nationally and locally. However, my inbox is overflowing with elderly residents desperately worried that despite being over 80, 90 and even 100, they have still heard nothing from their GP. With other parts of the UK currently vaccinating those significantly younger, what reassurance can my right honourable friend give to my North Devon constituents, please?
Sir State.
The reassurance I can give to my honourable friend, and more importantly to everybody living in North Devon, is that we will get there. We've set the goal of the 15th of February for everybody in the four most vulnerable groups, the over 70s and others, to be vaccinated, to have that offer of the vaccination arrive so they can be vaccinated before the 15th of February. The reason that we've set that is to make sure that everybody across the country gets it in a fair time, and that's why we're putting more vaccine into the areas that haven't made as much progress yet. However, I would say across Devon, just under 100,000 people had been vaccinated by the 17th, which a few days ago. So by now, I'm sure that Devon, over 100,000 people have been vaccinated, and so that shows that the rollout is happening, and we're absolutely determined to reach all parts.
Can I join my parliamentary neighbour, the member from North West Durham, in thanking those working very hard in primary care in County Durham to roll out the vaccine? When I speak to them, Secretary of State, they tell me that if they get the vaccine, they can get it out to those that need it. Last week, though, the vaccine hub in Chesley Street, Primary Care Trust hub, had to be put on standby because there was no vaccine arrival. Today, the Secretary of State again has announced new vaccine sites and suggests that people over 70 are going to get the vaccine. In my constituency, people over 80 are still waiting. Can I ask the Secretary of State and plead with him to stop the hype and the spin? Just be honest with people, be honest with primary care if there's a problem with supply, and make sure that primary care has enough notice to be able to organise this, because it's actually causing a great deal of pressure on an overworked system already.
Thanks very much, Mr. Speaker. Well, I'm delighted to say that primary care the GP surgeries across the country are rising to this challenge just brilliantly, and especially actually in County Durham, where they're doing an absolutely magnificent job. They're far ahead of the national averages in terms of the rollout and doing brilliantly. And so, of course, there are challenges. And of course, there are, as the supply comes in, we're getting it to the front line as fast as we can. And that does mean some rapid turnaround times. But I would just urge the honourable gentleman on this one to cheer up, back his local team. Yes, it's difficult, but I know that we'll get there.
Said to Sir Roger Gale in North Thanet. Sir Roger.
Thank you, Mr. Speaker. My right honourable friend is engaged in a Herculean task, and I think we all appreciate the work that he's doing. I know that he is aware of what he described as lumpy delivery of vaccines, particularly in East Kent. His honourable friend is sitting on the front bench, the vaccines minister, and I hope that he is addressing that issue as we speak. But two further matters. Would my right honourable friend consider ensuring that all hospitals should be allowed to have supplies to vaccinate their own employees? Because at the moment, National Health Service employees working in hospitals are still having to travel far too far to get vaccinated. And when the priority groups have been addressed, will my right honourable friend give particular attention to the needs of teachers so that they can get back to work, and also to the police, the constabulary, who are exposed every day of their working lives? Thank you.
Secretary of State.
Yes, my honourable friend is quite right to raise the issue of getting supply out to East Kent. In fact, we are opening more centres just outside his patch in Folkestone next week, and we are putting more vaccination into East Kent and putting the support in there to make sure that the vaccination rollout can happen. I'm glad to say that the majority of over 80s have now been vaccinated, but there's still clearly a lot of work to do. And he's absolutely right to highlight the case that both teachers and police officers are understandably making, that after we've got through the priority groups according to clinical need, that we should consider their case for early vaccination.
Said up to Ian Mearns in Gateshead. Ian Mearns.
Very grateful, Mr. Speaker. Mr. Speaker, at the Education Select Committee on Tuesday, we heard from the Deputy Chief Medical Officer that schools were as safe for pupils and staff as anywhere else. But it now seems this assertion is based on ONS ad hoc survey data that appears to be 3 months out of date. The assertion about safety in schools was repeated by the Secretary of State on TV this morning. However, more up-to-date evidence from the DFE itself shows that infection rates among school staff, teachers and support staff were significantly higher than the working population as a whole in December. If the government is determined to reopen schools, as we all want to see, and as a major priority, surely the vaccination of school staff should be ramped up the priority list based on this evidence.
Secretary of State.
Well, of course, we're very much open to the vaccination of teachers and more broadly, as he puts it, school staff. Once we've got through those who are clinically most vulnerable, of course, the vaccine programme has to first and foremost be used to save lives. I think everybody agrees with that. And of course, we look at all available data and information informing that view.
Let's head to Richard Fuller in Bedfordshire. Richard Fuller.
Thank you very much, Mr. Speaker, and I'd like to welcome the opening today of the Weatherly Centre in Biggleswade, which fills a gap in delivery across Bedfordshire. But I'd like to raise with the Minister another question that's arisen in Biggleswade and get some policy advice from him. Penrose Court is a residential care home in Biggleswade, and a positive cases have been recorded there amongst residents. The court was advised that there would therefore be a delay in the vaccinations. I understand today from the CCG that those vaccinations are now back on track, but can the Minister advise the House what is the policy when it comes to vaccinations of residents in care homes where there has been a recent positive case recorded?
Secretary of State.
Thank you, Mr. Speaker. This is a really important question. In the most part, even when there's an outbreak, a care home can offer vaccinations with their local primary care network to those residents who haven't got COVID. Of course, when this is done, very scrupulous infection control needs to be in place. For instance, many care homes have vaccinated in a garden hub to make sure that it's outside, which of course is so much safer if there's an outbreak ongoing. Now, sometimes an outbreak in a care home is so significant that you have to wait, and that has happened in a couple of cases. But all of these decisions should be based on the local clinical advice of the GPs who are in the lead on the rollout of the vaccination to care homes. I'm really glad this situation has been resolved in Biggleswade, and of course I'm delighted at the new vaccination centre that's pharmacy-led in Biggleswade, as he said, plugging a gap. And he'll have heard from earlier that colleagues across the House have been praising the rollout of the vaccinations in Bedfordshire.
Wheeling North with James Murray. James Murray.
Thank you, Mr. Speaker. I want to thank the local NHS in my constituency for their hard work to vaccinate people. And in the spirit of working together with them, I raised my concerns about the lack of vaccination sites, particularly around Greenford and Northolt in the northern part of my borough. And they agreed with my suggestion that we ask Boots to consider opening a community pharmacy site at their Greenford Westway Retail Park stall. I raised this plan with Boots, who were positive and helpful, and now we need support from NHS England. So would the Health Secretary please ask NHS England to look urgently at lending their support for this plan so that we can move forward without delay?
So, State.
Let's see what we can do.
Warrington with Andy Carter. Andy Carter.
Thank you very much, Mr. Speaker. I know the Secretary of State will want to join with me in praising the response of GPs, of NHS and care staff, as well as volunteers in Warrington, who are working at the 2 community hubs in the town. By the end of tomorrow, will have vaccinated around 17,000 people from this area. Looking forward, could my right honourable friend tell the House what plans he has to open 24-hour vaccination centres in the Northwest, so that anyone who works, say, for example, shifts or who has caring responsibilities can access a vaccination at a time when they might be available?
Okay.
Absolutely. We are we're going to pilot this approach, see how much demand there is for overnight vaccination. As you say, it could be particularly appropriate for shift workers. And of course, the NHS runs shifts in every hospital because of the need to care for patients overnight. So this is a very important point that he raises. And I'd also just say how glad I am that we've been able to open the Iman Pharmacy in Bewsey in Warrington, further expanding the vaccine rollout in his area.
Excellent. Tamarjeet Singh Desi.
Thank you very much, Mr. Speaker. I'd like to commend everybody involved in the vaccine rollout programme who've ensured that all care home residents in Slough have received their first dose. And I'd also like to thank the Health and Social Care Secretary and his team for agreeing to site one of the mass vaccination centres in my Slough constituency, which has been particularly hard hit by the pandemic. But can the Secretary of State advise when will detailed data be published on the vaccine rollout so that local public health teams and others can identify issues? And will that data be by age, ethnicity, region, and level of deprivation?
Secretary of State.
Thanks very much, Mr. Speaker. This afternoon, we'll be publishing much more detailed local information, and so that will be available. And as the rollout continues, we'll publish more and more granular information. He's quite right about Slough has had a tough time in this pandemic, but it will get both a vaccination centre, which is great. And it was a real pleasure earlier in the week having a Zoom with members of the Slough NHS team who have delivered this, every single resident of a care home in Slough being vaccinated, getting their first jab. So an absolutely terrific performance by the team in Slough, and I'm glad that he's as proud of them as I am, and they are a model that all can look to.
Can I just say to the Secretary of State, I'm just about to hand over to the Deputy Speaker, but I'll bring Richard Drax in first. Richard Drax.
Thank you, Mr. Speaker. First, can I praise and thank all the NHS staff in Dorset who are doing a wonderful job fighting this pandemic. Secondly, we hear from some scientists they want the country locked down until June, when 70% of the population has been inoculated. And according to Sir Patrick Vallance, vaccines are not going to do all the heavy lifting. But what are we vaccinating for if we cannot begin to reopen our devastated economy and regain our freedoms? Does my right honourable friend agree that this is about risk mitigation, not elimination, and that a path out of this lockdown is a decision for politicians and not scientists and modelers?
Thank you very much. The decisions that we take are decisions rightly for politicians, guided by the best possible science. And the challenge is how to get those freedoms that my honourable friend rightly refers to, how to get them back as quickly and as safely as possible. And the safety element of that is paramount, as is the speed. So the one thing that will help on both is to roll out the vaccines as quickly as possible and to monitor their rollout very closely so that we can see the effect of the vaccine on the transmission. And as we see more and more information about that, we'll be able to make clearer judgments about the release and when we're able to lift some of these restrictions under which we're all having to live.
Lillian Greenwood. Lillian Greenwood needs to unmute.
Sorry, Madam Deputy Speaker. Clear and timely communications are vital in maximising the take-up of the vaccine. Where people haven't responded to an invitation letter, I understand they'll receive a phone call, and that phone calls will also be used to ensure that all appointment slots are used. So can he assure me that calls will be accompanied by SMS text messages to ensure that deaf people and those with a hearing loss are not left behind?
Wherever possible is the answer. The truth is that the NHS hasn't in the past collected people's mobile numbers routinely or their email addresses, hence why this rollout is primarily being done through invitations by letter. I hope that actually as part of this rollout, one of the things we'll be able to do is make sure that the NHS can put people's email addresses and mobile numbers on their clinical record, where people consent to that, of course, because we've seen in other countries like Israel that where a very large proportion of people have given their phone number and their mobile number and their email to the health system, then you can get in contact with people much more quickly. Now, all of that, having said all of that, some people will never have a mobile phone and some people will never have email. And this is a universal service, of course it is. And so letters and texts to those who have poor sight, and ultimately phone calls, including on landlines or teams going round to people's doors. All of these things are important to make sure that everybody gets that access to the vaccine and can receive the invitation.
Before I call James Daly, just to say I do want to try to get everybody in, so we probably need to speed up a little bit. James Daly.
Thank you very much, Madam Deputy Speaker. Will my right honourable friend join me in thanking Bury Council, our local CCG, NHS staff, medical practitioners and all those involved in the vaccine rollout within Bury, Ramsbottom and Tottington. Approximately 19,000 vaccinations will have been given by the end of this week across the borough of Bury, and we are confident all frontline workers and care home residents will be offered the vaccine by Sunday. It has been and continues to be a magnificent effort.
Chief State.
That's absolutely fantastic to hear, Madam Deputy Speaker. And across Manchester as a whole, Greater Manchester, 187,947 vaccines have been done. It's been a huge effort, and I'm very grateful for my honourable friend's support.
Diolch, Madam Deputy Speaker. Frustrations with the Welsh Government's rollout programme are well documented.
and health boards in Wales have this week had to contend with some supply issues. Can the Minister reassure me that any supply issues are being addressed? And given that Wales has the largest proportion of people aged over 70 in the UK, at over 17%, can he give us some reassurance that Wales receives a vaccine allocation which reflects this level of relative need?
Secretary of State.
Well, all of the 3 devolved nations are getting their vaccine according to fair shares at the same speed as England. And so while supply is the rate limiting factor across the board, the same supply is going in the right proportions across all 4 nations.
We now go to Damien Collins.
Thank you, Madam Deputy Speaker. Yesterday, I visited the vaccination hubs at the Civic Centre in Folkestone and at Lydd Airport, which, along with the Oakland Surgery in Hythe, are doing a great job in vaccinating the local community. But does my right honourable friend agree with me that in Kent, we also need to see the mass vaccination centres opening as soon as possible, which can process tens of thousands of people a week?
Secretary of State.
Yes, I agree with him, and I'm delighted to say that next week a new vaccination centre will open in Folkestone, serving the people not only of Folkestone but the wider area across parts of East Kent, in addition, of course, to the brilliant work that GPs are doing in his part of the world.
We now go to John Trickett.
Thank you, Madam Deputy Speaker. Now, Wakefield CCG decided not to provide information to local residents about the vaccination rollout here. They said they feared it would lead to awkward questions from a sceptical public about differential treatment, a kind of postcode lottery for key workers, the elderly, or for the chronically sick. Would he confirm the comments he's made today, which I welcome, that more granular data will be released, but they are to be provided by huge or remote STPs? So will we know what is happening at the local level in order to maintain local public confidence? And finally, would he comment on reports in the HSJ today that next week they're going to cut by half the amount of vaccine in Yorkshire and the Humber?
Secretary of State.
Well, I'm delighted that across West Yorkshire and Harrogate as a whole, over 150,000 vaccines have now been done. And I would say to anybody that coming forward for a vaccination when you're invited by the NHS is the right thing to do. And I'm delighted to say that far from sceptical, the public are hugely enthusiastic about this vaccine programme, and we've seen the public attitude and enthusiasm to be vaccinated has shot up since we started vaccinating on the 8th of December. People can see with their own eyes the positive impact that this is making. Now, of course, we've got to make sure that that vaccination programme is fair right across the UK, and some parts of the country, including parts of the northeast and parts of Yorkshire, have gone really fast early on, which is terrific. And we do have to make sure that the vaccination programme is fair everywhere, so that everyone in the top 4 groups can receive that offer of a vaccine by the 15th of February. We will deliver on that.
Teresa Villiers.
Can he speed up the delivery of vaccines to London so we can catch up with other areas? And will he also emphasise that whilst the vaccine gives us all hope for the future, hope that restrictions can start to be lifted, until that point, we do have to be cautious. We do have to stick to the rules because the virus is lethal. It's putting immense pressure on our hospitals, and sadly, we're not out of the woods yet.
Secretary of State.
Well, I agree with every word that my right honourable friend said, and I'm really pleased that this week Brand Russell Pharmacy in East Barnet is opening for vaccinations, and we are accelerating the amount of vaccination in London, which is the region in England that has the most to do.
We now go to Hannah Bardell.
Thank you very much, Madam Deputy Speaker. I fully appreciate and respect the Joint Committee on Vaccination and Immunisation have a very strict protocol for the rollout of vaccines. But I wonder if they and the Secretary of State have considered the notion that staff working to develop and produce vaccines, like those at Valneva in my Livingston constituency, should get a vaccine as soon as possible. Will he give some consideration and discuss this with the JCVI? And I'll be writing to him shortly.
Secretary of State.
Well, thank you very much. I'll consider that the request, given the importance of the vaccine supply, which is critical for everybody else to get their vaccines too.
We now go to Tracy Crouch.
Thank you, Madam Deputy Speaker. This morning, Maidstone Hospital rather wonderfully did its 10,000th vaccination. Medway Hospital has done 5,000, Malling and Blackthorn PCNs have pretty much completed the first priority groups, and Lordswood PCN, which is only 2 weeks old, is motoring along to deliver the vaccine to vulnerable groups in Chatham. This is all down to the incredible work of all those involved, and I'm sure he'll join me in paying tribute to them. However, the one piece of feedback I repeatedly get across my constituency is the lack of consistency in supply. So will he reassure me that those who are delivering on target won't be penalised by their own success, and that they will get the stock they need to continue to vaccinate priority groups in the list?
Secretary of State.
Yes, of course, we've got to make sure that the priority groups are all offered a vaccine everywhere in the country, and to be able to be vaccinated by the date of the 15th of February. But I totally agree with her about the great effort locally. Reaching 10,000 vaccines is superb. I particularly want to thank Richie Chalmers and Cheryl Lee and John Weeks and the whole team at Maidstone and Tunbridge Wells Trust. You know, there have been very significant challenges in Kent over the last few months. Thankfully, the case rate appears to be coming down in Kent, which is very reassuring. We've got to get this vaccine out as quickly as possible.
I go to Daisy Cooper.
Thank you, Madam Deputy Speaker. In St Albans, our GP-led vaccination centre at Batchford Hall is doing a brilliant job, but they only have enough vaccine supply for 2 days a week, not 7. But now we're hearing rumours that the NHS might set up a large hub in St Albans, which honestly we don't need if our Batchford Hall centre was getting the vaccines that they need. So can the Minister confirm that the NHS will be putting all of its efforts into helping put the infrastructure in place in parts of the country that need to catch up, rather than duplicating infrastructure in areas that already have excellent centres but just need that extra vaccine?
Secretary of State.
Well, you know, the truth is, Madam Deputy Speaker, that supply is the rate limiting factor. So we do need to put the vaccination centres where they are best needed, and pharmacy has an important role right across the country. But where the Honourable Lady is right is that the rate limiting factor is the amount of supply, and that's what we're constantly calibrating to get people as much supply with as much notice as we can, given the challenges that we all face.
We now go to Philip Dunn.
Thank you, Madam Deputy Speaker. I applaud my right honourable friend and his colleagues across the NHS, and especially here in Shropshire, for the massive effort by so many people to get this vaccination into those in the highest priority groups so quickly. But there are still some parts of the country where only care homes and NHS frontline staff have been vaccinated. And in the South West Shropshire Primary Care Network, no one in the community over 80 has yet received a vaccine. None are expected until late next week. So can my right honourable friend, in common with the pleas made from a number of other colleagues in this session this morning, look at prioritising deliveries to those areas where the highest priority groups have yet to receive the vaccinations which they're being led to believe are now widespreadly available?
Secretary of State.
Madam Deputy Speaker, across Shropshire and Telford and the Wrekin, there have been there's been 14,000 doses delivered to the over 80s. I will look into the specific question of the PCN that he raises, because I wasn't aware of that fact. And clearly Shropshire is vaccinating the over 80s, but I'll look into this specific. It's true that right across the country, the catch-up of areas, if they are behind, is absolutely vital, because it's right that this is done fairly across the country. And so I will get back to him with the details about the individual case that he raises.
Now go to Steve McCabe.
Is it true, as has been reported, that up to a fifth of staff in some care homes have refused the vaccine? If so, does the Secretary of State have data on this and a plan to address it?
Chief State.
Well, we are aware that there are some care homes in which the take-up by staff is not universal, is not 100%. I don't quite recognise the specific figure that he gave. I'm very glad to say that in some parts of the country where a team have gone into a care home and not all the staff have taken the vaccine, when they've then returned later, a couple of weeks later, then they have been able to complete that rollout to staff, because staff have been reassured by having seen the rollout to their colleagues and the residents that it is okay to get the vaccine. You know, the good news is that overall take-up and enthusiasm for take-up is very, very high. And we've been hearing today of some cases where amongst residents of care homes, there's been 100% take-up. I'm really, really pleased about that. And I'm particularly pleased that the overall enthusiasm to get the vaccine amongst the population as a whole has risen quite substantially over the last 6 weeks. So we work very hard on this. It's an incredibly important issue, and we absolutely have a plan in place to address it.
51 withdrawn, so we go straight to Tonya Antoniazzi.
Thank you, Madam Deputy Speaker. Can the Secretary of State confirm that people living with a terminal cancer diagnosis are to be included in the vulnerable groups for vaccination?
Secretary of State.
Well, the vulnerable groups are set out clinically, and those who are clinically extremely vulnerable include those to whom we have written, in some cases regularly, during the pandemic. That's a clinical decision, and I think it's right that it should be a clinical decision.
We now go to Paul Bristow.
Thank you, Madam Deputy Speaker. The vaccine rollout in Peterborough is going well. Sites are open at the City Hospital and at a number of GP surgeries and medical centres across the city. And I want to place on record my thanks to everyone working in these centres across Peterborough. But I still feel Peterborough needs a mass vaccination centre in our city centre. Will my right honourable friend confirm that there are plans for a mass vaccination centre in Peterborough that will serve many thousands of people in my city?
Secretary of State.
Yes, we're going to have a mass vaccination centre in Peterborough, alongside all of the work that the GPs are doing. We hope that it'll be open next week, and I want to thank the NHS in Peterborough for the work that it's doing and for getting this going.
As number 55 has withdrawn, the final question will be from Stephen Doughty.
Thank you, Madam Deputy Speaker. And can I praise again the work of Cardiff and Vale Health Board in their vaccine rollout yesterday. They delivered 10 times the number of vaccines in one day than they did on their first day of delivery of this programme, and they're doing an incredible job. But the Secretary of State rightly said that supply was the limiting factor. This morning we heard that the Vocart factory in North Wales had been affected by flooding. Could he confirm whether or not any supplies have been damaged or affected? We've also heard that the Serum Institute factory in India has been affected by fire this morning. What is the Secretary of State doing to ensure that we have more manufacturing capacity, more fill and finish capacity, and that we have a backup in case something goes wrong, because it would be devastating for supply of this critical vaccine?
Secretary of State.
Thank you. We absolutely have plans to make sure that we can get this vaccine out, even with significant challenges. We don't take any supply from the Serum Institute of India. That supply is for the developing world. And the Vocart, the company who do the fill and finish in Wrexham, have put out a statement around the serious rain and flooding that there's been in and around Wrexham over the last few days, and obviously this is an absolutely critical factor. On the point that he raises about making sure we have the manufacturing capability, we are investing in that capability for the medium term. But the reason that we're able to make so much of the Oxford AstraZeneca vaccine in the UK right now is because of work that has been done with the Vaccines Task Force over the summer, getting in the capability and the manufacturing, even when the vaccine wasn't the major topic of discussion. We were working incredibly hard to expand the UK capabilities And we took the approach that we should buy from abroad and make it here at home. It's about getting vaccine into the arms of people, no matter where it comes from, so long as it is safe and effective and does the job. And that's what's happening right across the whole UK. It's really good, Madam Deputy Speaker, to finish with a question from a Welsh colleague, because it just demonstrates that this is a programme that I hope can bring the whole country together. It's something that everybody is on the same side trying to make happen, and we'll all keep working on it together. And I want to thank everybody involved and thank all colleagues for their enthusiasm and support for the vaccine rollout programme.
I thank the Secretary of State for responding to the urgent question, and I am suspending the House for 3 minutes to enable the necessary arrangements for the next business to be made.